Welcome back to Insurance World TV, your go-to channel for all things insurance related. Today, we're diving into the often confusing and complex world of health insurance. And we're not just talking about your typical medical coverage, oh no, we're zoning in on an area that often raises many questions. Mental health coverage under psychiatric and psychotherapy limits. So, if you've been scratching your head, wondering what exactly these terms mean and how they affect your coverage, you've come to the right place. We'll be breaking it all down for you, making it as clear as crystal. So buckle up and let's get started on this enlightening journey into the heart of your health insurance policy. Ever wondered what is covered under psychiatric and psychotherapy limit in your health insurance? Well, you're not alone. Health insurance coverage can be a tricky subject, especially when it comes to mental health services. In this video, we'll demystify these terms. We'll delve into the psychiatric and psychotherapy limit, breaking down what exactly these terms cover within your insurance policy. It's time to navigate the often complex world of health insurance with ease. Stay tuned to learn more about what your mental health coverage might entail. First, we dive into the term psychiatric. What does it mean in the context of health insurance? Let's break it down. The term psychiatric in health insurance refers to medical treatments that focus on mental health conditions. Now, this can be a broad spectrum encompassing everything from anxiety disorders to more severe conditions like schizophrenia. Psychiatric coverage essentially provides a safety net for your mental health. It can cover the cost of consultations with a psychiatrist who can diagnose and treat mental health disorders. It also includes the cost of prescribed medications, which can be vital for managing these conditions. In addition, psychiatric coverage may also extend to hospitalizations, should there be a need for more intensive treatment or monitoring. This could be due to a severe episode or a crisis situation. Other treatments like electroconvulsive therapy or transcranial magnetic stimulation prescribed by a psychiatrist could also be covered. Psychiatric coverage is crucial for those who need mental health support, but what about psychotherapy? Next, let's unpack the term psychotherapy. How does it translate in the realm of health insurance? Psychotherapy, often known as talk therapy, is a broad term referring to a variety of treatments that can help individuals understand and manage mental health conditions. It's not just about discussing life's ups and downs, but about working with a mental health professional to identify and change thought patterns and behaviors causing difficulties. In the context of health insurance, psychotherapy coverage typically includes individual therapy, where the patient works one-on-one with a therapist, but it doesn't stop there. It can also cover group therapy, where several patients meet to discuss their issues under the guidance of a professional. Couples therapy and family therapy, where relationships and family dynamics are the focus, can also fall under the psychotherapy umbrella. So now we know psychiatric covers the medical side and psychotherapy covers the talking therapy. But what does this mean for you? You might be wondering, what does the limit in psychiatric and psychotherapy limit mean? Well, in the simplest terms, the limit represents the maximum amount that your insurance company has agreed to pay for your psychiatric and psychotherapy treatments within a given year. Think of it as a cap on the financial responsibility of the insurer. This limit is not a random figure, but is influenced by a variety of factors. Let's break them down. Firstly, the terms and conditions of your policy play a significant role. These are the rules of the game, so to speak. They define what is covered and what isn't, and they also set the maximum amounts that the insurance company will shell out for different types of treatments. Secondly, the premium you pay also impacts your limit. In general, the higher your premium, the higher your limit. This is because you're essentially paying for a higher level of coverage. Lastly, your health condition can influence your limit. For instance, if you have a pre-existing condition, your limit might be lower as the insurer considers you a higher risk. On the other hand, if you're in good health, your limit might be higher. So, there you have it. The limit in your insurance policy is a crucial element that determines how much coverage you actually have at your disposal. Understanding your insurance limit is key to making the most of your coverage. So, we've explored psychiatric and psychotherapy coverage in health insurance, but what are the key takeaways? First and foremost, we've established that psychiatric coverage pertains to the treatment of mental health conditions, typically involving medication and hospital care, while psychotherapy coverage relates to therapeutic treatments such as counseling and behavioral therapy. These coverages can address a wide range of mental health needs, from mood disorders and anxiety to more complex conditions like schizophrenia or bipolar disorder. The breadth of this coverage can be a lifeline for many in their mental health journey. We've also underscored the importance of understanding your insurance limit. This is the maximum amount your insurance will pay for these services in a given period. It's crucial to be aware of this limit to avoid any unexpected costs. In conclusion, always check your policy or talk to your insurance representative for specifics. Remember, understanding your coverage can make a huge difference in your mental health journey. Thanks for tuning in, and be sure to reach out with any questions.